All right, guys, I'm very excited about this. We have two people in the room at the table who sometimes would be considered maybe enemies, maybe not, don't respect each other. And that's not what we think. That's not how we feel. We've got Bruce, and you run a very, very successful physical therapy office that really is on the insurance hybrid side. And then we have the evil one. No, I'm just kidding. We have Ron, who's down in Orlando, who has created a very, very successful cash-based business. And as we talked before, sometimes there's this divide where we don't respect each other. We've talked. It could depend. It's not true. Right.
I mean, there is this huge animosity that's out there right now. And there is a very, when it comes to what kind of patients we're treating and why and what type of model and how should we do this, there's so much infighting in physical therapy right now. And I think I can speak for most of us. We're tired of hearing about it. Can we work together? Can we combine as a team to make meaningful and practical change? And, we run our businesses differently. And guess what? We both get our patients better. And that's what matters, right? And we're working with Torrentia to make meaningful change for other clinicians. That's what it's all about. That's why we're here.
Yeah. And your ability to learn from each other.
Yeah.
I'll steal anything from anybody, right? I stole from a steel company once on how they manage their employees. He goes, "You do know I make steel." And I go, "Yeah, but it's a great idea. I'll steal it." There is something that I know that has never happened in either of your practices, insurance and or cash. You have never had an employee come to you and ask you for more money. Is that true?
Yeah.
Ever.
That's funny.
Once or twice, right? But one of the things that I'd be fascinated to know from both of you is, let's talk about that practitioner. You were practitioners before, and you know that feel like, man, I need more money. My wife's at whatever. So if I'm a practitioner and I came to you, either one of you, what would be the thing I would need to tell you or demonstrate to you that would say, I'm worthy of a raise? What would you like to see from me? Because I think practitioners need to hear that from an owner's perspective.
Yeah, I can go first. Yeah. Business problems are business problems. So whether you're insurance or hybrid or cash, businesses still have problems, and you can learn from each other to solve these problems through experiences. Right. So business is business. We all have problems. This is a very common thing with employees asking for raises. How I like to handle it is there should be set expectations, number one. So the employee needs to know how to get the raise. So we share the numbers. We all work as a team. We all play the great game of business. We have a business goal. Each person has a stat, and they know to get to tier 1, tier 2, tier 3, and Jedi Knight level, which is the last ranked level, Jedi Knight ranked, of what is needed to get to the raise. And it's based off of stats. So we have a production-based system.
So my question is this, and I think that's awesome. And I love that you have that well-defined. I'm not surprised, Ron, that you have that. But I'm the practitioner that comes to an employer who doesn't have that. What should that practitioner be willing to say or do? And this could be for either one of you, to come to you and saying, hey, I need a raise, but let me tell you, what would you be looking for to give them that if you didn't have that wonderful format?
You have to flip it and look at from the company value. How are you going to increase value to the company? So you can't think of it like an employee and me and me and me. How can I increase value to the company? And then you make the numbers work to provide the raise.
So consider the owner's perspective before you're coming in.
Correct.
Okay, so tell me, give any thoughts you have on that, Bruce?
I mean, I agree 100%. There's one word there that's all that matters: value.
Yeah.
But I will argue, value doesn't always mean money. If we're bringing in even a new clinician that starts that's a hand therapist, that's a whole separate level of patients that we were never able to reach or help possibly before. That's value in itself. That's marketability. That's brand building. That's new relationships with new providers, with new patients that we normally would not have been able to help until then. So there's more to it than dollar signs. But do dollar signs what make the money, what makes the world go around? Absolutely. If you can bring a new service or treat a new patient population that can then generate the clinic more money, yeah, you deserve to be paid more without question, but there has to be a value proposition there.
So what I heard you say, and just want to repeat this, is that it could be money, but you're also saying the value, and we need to consider it from the owner's perspective. Put yourself in their shoes. Be able to say, I can make you more money by doing X. I can bring a new market share to you. I can bring a new practice. Another thing we didn't say, which I know is in there, is we found a way to make you more efficient. We've found a way to save more money, to do it quicker, to save on supplies or whatever else. Would you agree that it could be a combination of all three or all four of those?
Yeah.
Yeah, I'd even add in, that was a great point, by the way, with adding a new service. Like you can run the golf program, you can run this niche market, you can run the shockwave program. That's a great topic on that one. I would even add a fifth one. Again, it's going back to numbers. You know, I like numbers.
Yeah.
Create a bonus program so they know what it takes to earn bonuses.
Right.
Like we have a program set for every word of mouth referral you get $25. For every testimonial you get 50. So again, the employee will know exactly what it takes to get more money, either through a salary or through a bonus program. We've created that. So there's clear expectations.
Yeah.
I think that's
well,
another thing to add.
And I think you've done something. I'm not saying you haven't. We haven't talked about it, but we're going to flip it from the other side on the same subject. Employees who want more money, or we want to give them more money. I don't think you sit there and go, man, I want to pay them the least amount of money as I can. In both of your practices, let's flip it. Now you're the owner. And you've said a couple of things already. One, you have a system created out. You have a bonus system set out. Those are exceptional. I would guess those are the exception. Most practices don't have that. Would you agree to that or not?
Most don't.
But I think there are other ways to incentivize.
Yeah.
Money is not always what people want.
Mm-hmm.
Some people want time.
Mm-hmm.
And being able to provide time, freedom, and flexibility to your team is important. But them being able to reflect back that value proposition at the same time, difficult. You have someone who wants to work remotely. Okay, I support that if that's what you want, but how can you generate revenue doing that? And then the crickets go, right? Being able to come to the table with a value proposition of how you can be productive in this location, or how we can, make the clinic more money. I mean, that's how you're going to make more money as a staff therapist, no question.
Who's more responsible for this topic, the employer or the employee?
Both.
I know both, but give me, is it equal? Or is the employer more, could it be more valuable if the employer had clearly laid this out?
Oh, absolutely.
And explained it to people? Because I think when you were in PT school, did anybody have that conversation with you?
No.
Here's how you bring value.
No.
Here's how you make money.
That's the class we miss, right?
Yeah.
We don't learn business in graduate school. We learn how to treat patients well and be generalists, and then we have to learn to get good on our own, right?
Yeah.
Yeah, I would say traditionally it's been the employer's responsibility. And I feel like the smooth road can be paved more effectively if the employee takes a little bit of that burden and shows up to that, no question. But I agree with Ron where we have to have clear expectations and a pathway to whatever it is that they value, whether it's money or it's time or it's freedom. What's the pathway to get there? And if you don't have a pathway to get there, that's where high turnover occurs.
Yeah.
Right.
And would you agree that there's this thing called asking people what they think or what they want? I have very often assumed that I know what they want, and I'm almost always wrong. So I think that's for both, whether it's an insurance company or a cash base. I think the same thing. That's the thing. There's not. You said business is business. Yeah, business is business. Well, let's flip this. Let's be a little bit more adversarial. I love that because I'm not a part of this. This is good. Tell me, when you decided to be in the insurance business, hybrid business, what was the reason you did that? And why was that right for Helena, Montana, where it might not have been right for Ron in Orlando. So talk to me a little bit about that. And I'm going to flip it. Same thing for you. Go ahead.
That's the key. Helena, Montana, right? Cash-based works, traditional works. What works better depends on the market, depends on the state, depends on reimbursement rates, depends on what people are willing to pay, depends what people value. And it also depends on what your vision is. A bigger clinic, a smaller clinic, being a little bit more of a solo practitioner and owner, having a team that you can rely on, work together. All of these things play contributing factors. But there are certain states in the United States that reimburse so low that traditional models are struggling, no question. And what they're resorting to is seeing 2, 3, 4, 5 patients an hour.
Mm.
And it's hard to provide high quality of care when you're in a, as we call it in the PT world, a mill, right? In Montana, we're able to run a traditional model with some cash-based services that allow for us to be successful. And when you're in a small rural town, you know, there aren't millionaires walking around the streets, and people are looking for that, healthcare.
Right.
And part of it's what your vision is and what the market can display. And my vision was to be a community-based clinic that was providing high-quality services, and we've done that. And I've done that through finding great people who care about the mission. So yeah, it depends on where you're at.
Yeah.
Market matters.
I agree with that.
Same question.
That's good. I mean, you said those first 7 things, we could have a whole podcast episode on that. But the 2 main things that I would say focus on is, what is the owner's vision? What type of clinic do you want? Do you want a small solopreneur clinic? Do you want to stay small and just treat 101? Or do you want a big clinic? Do you want to grow and scale? Do you just want a small business of 4 employees? First step, you have to decide on what's your vision as the owner, and what do you want your company to be like? 2 is, yes, market plays a huge influence with market reimbursement rates, the size of the market and stuff like that. And again, when you're thinking about opening up a PT clinic, you really think about, okay, what is best model for me and my market and my vision? And then sometimes I think the future is going to be hybrid. It's not just here, it's going to be in the middle and working together as both to achieve the business goals. People will probably be a balance of both a little bit in the future. But yeah, the market's going to dictate what is the best model for your practice. Mm-hmm. And then what type of business do you want? What's the 5-year vision? What's the end goal? And you start with the end goal and go backwards. So those 2 things, I would say, are the main factors on deciding what business model that you want to go into.
Rather than talk about the differences, and there are differences, and I love the fact that you chose based on vision and based on your market and vice versa. But there's something that I've heard as I've interviewed both of you that to me is something we don't focus on. What is the same? And it's about values. And tell me about, at this point, I want you both to talk about what are the values that are the same for both of you. The business, whether it's that's monetary. But talk to me about what's the same about you and that you're not willing to alter because it's part of your values. Talk about that.
Guarantee it's going to be patients first.
Absolutely.
What's best for the patient is first, regardless of model. You would agree with that totally.
100%.
I heard you say that multiple times.
And what's cool about being a physical therapist and what's beautiful about being a physical therapy practice owner is that when we put patients first, the success comes with that. It's beautiful. If I just do what's right for the patient, it's usually also what's right for the business too. Yeah. And yeah, we have KPIs. Yes, we have metrics. I have a small clinic. We have 8 providers in Helena, Montana. I don't have, 20 clinics throughout the United States or a giant franchisee. But you know something? I run it like a giant corporation. Do I shove those numbers down my staff's throat? No, but it allows me to make good, educated decisions on how we're going to grow and expand. But if I'm able to put them first with this information, I mean, it's all about people. It's all about relationships. It always has been. And I always say patients first, Staff, dang near close second, without question. We have to put them first too, because if we're not willing to make sacrifices, make changes, make adaptations in our business model, make adaptations and changes to how we can get patients better, then what are we doing? Because if we're not growing, we're dying.
I would even add into this
Please.
is that I view the two most important things that patients care about are results and the experience. And regardless of cash or insurance, the experience you give the patient would be another similarity in good businesses, regardless of cash or insurance. If you can deliver results and give them an exceptional experience that blows their mind, that sets you apart from your competitors, that's another thing, regardless of the business model. If you focus on the patient experience and clinical results, that's another similarity. Because again, business is still business. You're still running a business, just a different model. But again, clinical outcomes and results. And if you give an unbelievable patient experience, which healthcare needs a patient experience course, by the way, because it's a horrible patient experience. That's another thing that good businesses, good PT clinics, regardless of insurance, hybrid, or cash, can also have the same factor that's involved in business.
Absolutely.
The thing that you've said, alluded to, but I want to make sure it's very clear. Again, we're talking about patients. We're talking about employees. And the third thing that I would say, if I'm going to categorize on the third one, I would be, is running like a business, knowing your numbers.
Absolutely.
I think there are some that can do the first, can be great clinicians. They might even provide, the people like them. But at the end of the day, if you don't know your numbers, don't know your business, it doesn't matter whether you're cash-based or this. You better know your metrics.
Absolutely.
And that, I think that's where a lot of businesses are failing. That last one. We talk about the class they missed.
Right.
But I think they've missed a lot of classes, but that's a whole nother subject there. We got just a few more minutes, and maybe I'll just ask this question because we're talking about employees. Is there any difference in how you hire people, or what people are looking for when they come to your clinics? Are there employees that are saying, I really want to be in a cash-based business? Are there people say, I really don't want that, I want to be in the hybrid or the insurance business? Are you seeing practitioners looking for something specific? Or is it more, I'm looking for a tribe, I'm looking for a family? Tell me.
Physical therapists want to work somewhere where they feel valued and a part of a team.
Mm-hmm.
I've watched so many great PTs get dragged through the mud, get stomped on, get discouraged by models, systems, employers, coworkers, and it's defeating. Environment is everything. Culture is everything. And if you can create a place where people like going to work and they have fun, it doesn't really feel like work then. And it's not. Most PTs love what they do. Despite the fact that we have these, high mental health issues, these high physical disability issues, these, 10% of our profession leaves every single year. You know what? We still rank as one of the most satisfying professions in the entire United States. We love what we do and we're good at it. But if we're not in an environment that's, facilitating people thriving in a positive work culture and having the freedoms and the flexibilities and being able to financially make it, be able to pay our bills, be able to actually save and invest toward a future, then yeah, no one's going to want to work there without question. I think it's really important to, whether you're a clinic owner and a boss, and creating an environment that people want to come work at, but also when you're, interviewing at places, don't talk to the boss, talk to the people that work there. Say, hey, what's it like over there at Advocate Physical Therapy, over at Pursuit Physical Therapy? See what they have to say. I think that's a really good piece of advice. Talk to the employees that work there.
We listen to 80s music. I mean, who doesn't like 80s music?
I do, because I'm in that genre.
It increases employee and patient satisfaction no matter what. I would say definitely on that, totally agree with that. Make sure that the employee matches the company values and purpose. I would say that's number one, because when that's not lined up, it creates conflict. Two, make sure your employees are taken care of, exactly how you said. Regardless of the model, the employee has to love coming to work, enjoy coming to work. You need to understand the employee. What do they value? You said it earlier. Do they value some time off? Do they value the freedom to go to their kid's game? Understand that and make that happen for them. Still make it production-based, still make sure it works. But yet, if that patient doesn't value money, but they value family time and freedom to block a time to go to their kid's game, understand it with each employee a little bit, and just make it a good work environment.
Yeah.
Little things like team building events, make it fun to work there. Just like Bruce said, don't just interview the owner, interview the employees and see how long they've been there, see what they say.
Yeah.
Absolutely.
Really, when you encapsulate a lot of what you're talking about, it doesn't matter which model you've chosen. It's about culture. It's about culture. And everyone has a culture. The question is, are they working on it, or are they ignoring it? Or do they even understand it? A culture is everything. They said culture blows away strategy, blows away anything that you can think about. It is about cultures, number one. And the last thing I'll leave you with, and you both said it, and I'm glad you did because I was going to ask you about it. Do you know one of the words we almost never use in business? Fun. It's okay to have fun.
Absolutely.
And we need to have fun.
Mm-hmm.
We need to create an experience with our employees that it's fun. It's still work. Don't get me wrong. It's work, and work is work. But we can create a culture, whether you are an insurance, whether you are cash-based, that a culture is incredible, that people want to come to work, get great outcomes, and we can have fun. Let's have fun. And I think we're going to have fun together.
I think so too.
Yeah. Thanks so much. It's awesome.
Thanks, guys.
Hey, it's Bruce and Ben. We wanted to take a moment to welcome you to our YouTube channel, Torrentia Medical Education.
Torrentia was created for rehabilitation professionals of all kinds to really work together to start changing the way that healthcare is currently being practiced and what the future of healthcare looks like.
We hope that our content and community helps inspire you to be a part of the next level of clinicians that are going to treat our patients out in the world today.
Beyond just joining us in our free community that we call the Torrentia Tribe, you can also check out some of our events on our events page at torrentia.com. Each and every one of our orthobiological hacking conferences and events and future events to come is really designed to help you really master and learn these regenerative concepts, as well as take charge and move the rehabilitation profession forward.
We're really excited about the orthobiological hacker certification, and we have much more content coming. So subscribe, check out our YouTube, check out our website, join the community, and we hope to see you at our events.
And remember, a storm is coming.
Thanks so much for watching.